Hey beauties, and welcome back to Aesthetic Chat with Kiki. As you know, I'm your host Kiana Gamble, and this is another episode of the podcast. Also very cool, this next guest reached out to me, and she has her own podcast as well. So I'm excited for you guys to listen to this one. Welcome, Claire O'Brien. I would love for you to start by sharing your journey into aesthetics.
Thanks for having me. So I'm a nurse practitioner. I've been a nurse practitioner since 2010 and had actually a background in surgical oncology. And one of my first jobs ended up staying in for, 8 years was ENT and head and neck. And we actually used to work with neurotoxin for facial paralysis, salivary patients, just kind of various migraines, various different things, but really had a lot of experience with, the face and the anatomy of the face, which was great. And I was in an academic cancer center and was just very, kind of working to death, even though I was trying to go part-time and I had 2 young children. And a friend of mine who was a physician had just started practice about an hour and a half away from me. And she had started doing in-home visits for family and friends that then quickly grew to tons of people, her hiring an NP and a PA. And she was actually going back and forth to where I was living with Charleston, South Carolina. And she said, "Do you want to inject for me? I just can't go back and forth down there anymore." And so we talked and ended up actually, becoming business partners and went from there to where we are now at the Skin Clique. But where I really learned aesthetics was, from her and various trainings and just, going through seeing patients and getting that experience. But that's how I came into it. It was just through my friend, Dr. Sarah Allen.
That's awesome. So how many years ago was this? What was this transition? You said you've been a nurse practitioner for about 10 years?
13 years now. And this was about 4 years ago, 4.5 years ago. So around 2019-ish.
Okay, nice. And then, so you and your business partner came together and created the Skin Clique. Walk me through the creation of that concierge medicine model, as well as just the creation of a business as you're still kind of trying to navigate injecting.
Right. It's like building the plane whilst you're flying it in the plane.
Yes.
So, our model is different, and we know that. We do all in-home visits. So we do neurotoxin predominantly. Then, we have dermal filler, skincare, chemical peels, really all of those core services are our bread and butter. And I would say the main thing that was really important when we were starting and as we expand, we're in 32 states now. So like every time we go into the first thing we look at is the laws, the regulations, what does that state allow for? There's certain states we can't go to, just regulatory issues in that state. Like Alabama is a great example. Alabama, only physicians can inject, which is absurd. But so like for us, that doesn't really work for our model. We use NPs and PAs predominantly, some physicians, but, RNs, who are some of the best injectors in the world, most of the states won't allow them to practice as independently as it would be needed for them to go into somebody's home. So like we can't really use RNs. So laws and regulations, and then really everything that we do is set up so that we are doing things the most safe, legal, buttoned up way it could possibly be. And when Dr. Allen was kind of starting out, she was like, "Listen, I know this is happening. People are doing Botox parties. You've got a friend that's a dentist or a physician and they're doing Botox in the home, but they're not doing it the right way, right? Like people are drinking, they're not signing consent. They're doing filler and they shouldn't be. They don't have the right med mal. And a lot of people don't realize this when they're doing these pop-up events. If you're outside of your office and your med mal is set up for your office, you're not covered, right? Like it's not set up for you. It's set up for where you are. So just a lot of things like that we, focused on in the beginning and thankfully found, some really great attorneys along the way and now have a multiple kind of groups of attorneys that specialize in different things that just really make sure that we're doing everything the best way that we could possibly be doing it in the safest way. So we carry resuscitative equipment and everything you could possibly need. We have it set up that way.
Is there like a fee associated with coming in the home? Do you bring like an injection chair? Or are you injecting them like in their kitchen? Just kind of walk me through a day in the life of you doing concierge medicine.
Yeah. So it's great because all of our schedules are set how we, want them to be set. So like I, have 2 young children and I typically inject while they're in school, which is 8 to 3. So that's my schedule and my time. And every patient's different, depends on what they need. So a lot of people are really comfortable, needle phobia is like very real. I don't know how many people you've had pass out.
Mm-hmm.
Yeah, but it's very real. So a lot of people are very comfortable with when it's just neurotoxin, like laying down on their couch. If I personally take a chair, if I'm doing filler, so it just depends on what the person is doing. But when we go in, we actually carry Cavicide wipes. So like if say I'm doing you want to be sitting at your kitchen counter, I'll wipe everything down with Cavicide. And I always tell my patients, I'm like, it's not because you're dirty. I'm just creating a clean space here. And then, we drape everything. We have a blue drape and set out all our equipment, whatever we need. But in terms of fees and things like that, our prices are typically extremely competitive within the markets we serve. They do range kind of like all injectors across the country, are very experienced, very high demand injectors might charge a little bit more per unit. We do charge a very basic $25, what we kind of call clinician access fee, because my patients have my cell phone number, right? Like they have access to me essentially 24/7. I mean, all day, every day they can ask me their skincare questions, their, neurotoxin questions. And if they say need a touch up because they've got a whack brow, then I'm going to come back and do that for them, for no cost. So very, very basic fee of $25, but then it's per unit, just like everyone else for neurotoxin.
Okay. How does that work in terms of, for body mechanics? Does your body hurt if you're like bending over someone's couch or, you're kind of walking in to places where you potentially don't really know the surroundings? Like you don't have people send photos of where they want to be injected or anything like that, right?
Yeah, no. So if it's someone new, I typically will kind of look around and say, okay, let's go over here. Like this is a good light and a good chair situation. So I'll kind of look around and assess where I think is the best way to be, unless if I've got someone that's really jazzed about laying on their couch because the needle phobia is very real, then that's fine. And yeah, it can be a little bit more uncomfortable for a little bit, but it's pretty rare that somebody needs to lay on their couch, but they do. And that's fine.
And then what do you say to those people that are undoubtedly going to say, you shouldn't be going into people's homes or workplaces. There's no way you can make that a clean, sanitary area. What do you say to those people?
I know, right? So a couple things. One, COVID was so interesting to me because typically people who say that is going to be your derms and your plastic surgeons, right? Because they're always going to be in-office-based physicians, which is great. When COVID first happened, they were the first folks that we saw shift to this model and shift to drive up Botox. And, it's like, okay, so it's not fine until you need it to be fine. And now it's fine. So that was a little bit, kind of funny and validating. But, I think that with, going through what I just went through, like the setup and everything, when we go in, like I said, I Cavicide my area and then put down, a blue drape. I can't say that any office that I've ever worked in, including, the hospital cancer setting, is doing a Cavicide wipe after every single patient that's coming in there. And, it's really about what you create when you go in, a brand new blue drape every single time. And all of your equipment is right on top of that. And like, if we're doing old therapy or filler, sometimes I'll take my own table. It just depends on what we're doing. And, neurotoxin's not a sterile procedure. It's a clean procedure. And you really just create that little space that you need. I mean, it's so interesting. I'm in this like big Facebook group with like 20,000 members, and just love seeing, all the different things. People are bringing dogs into their office, and dogs, cats, animals, whatever. I mean, there's a huge variation in aesthetics across the country. And so I just think it's about the space that you create, and we have the appropriate equipment to do that. I also think too, one thing that people are wary of, as they should be, is something like filler. And, I can see filler if you're by yourself and you're inexperienced and you have no one to call or turn to, then it's not about like the cleanliness for me at that point. It's, do they have the appropriate resources? And I can tell you from people that have come to work for us and various groups that I'm a part of, I know people that worked in, derm, plastic, or med spa situations that literally weren't allowed to call their attending physicians. They weren't allowed to call their supervisings. They were told, don't reach out to this person, never call them. You call, the office manager or whatever. And so what we provide, I mean, we have a 24/7 network of physician and APP support for all of our injectors, and not all of our injectors. Most of our injectors actually don't do dermal filler, but so I'm just like, listen, we have the highest standard for this, or that's as high a standard as anybody else in the industry in terms of support for our injectors and what they need. So it's just that confidence of knowing, seeing what else is going on out there and being like, okay, we're not going to do that. And we're certainly not going to do this. And just making sure it's the highest standard in everything that we do.
You make great points, especially in terms of support. If an injector doesn't even have support in, a brick and mortar clinic, what's the difference compared to you going to the client? So I think that those are some great points that you make. Last question about the concierge medicine. How long are your appointment times?
So, if it's a one-person appointment, I mean, that's what I kind of love about this model. It can be 20 or 30 minutes at their house, which I love. I sit down with them. They bring out their skincare. We chat about it. We really know our patients and their families. Whereas if we're in an event setting, like say we're doing a pop-up somewhere, those are more like 15 minutes, especially if it's a return patient, you know their dosing and where you're going and all of that can be 10, 15 minutes. Whereas the in-home appointments are longer, which I think people really, the connection is a different level when you're in someone's home and really sitting down and chatting with them.
Have you ever had any issues in terms of safety for yourself going into a home? Just because I know that safety can be a huge issue for anyone that's even doing home health services, anything like that.
Yeah, no, for sure. We have not yet, but we tell all 230 of our injectors, we are never going to say, oh, you should have gone in that house. Why didn't you go to that patient's, wherever they were? If there's anything that feels out of place or whatever, we're like, that's fine. Don't go. That's totally fine. So I can think of one instance where there was someone in a hotel room and they just were like, I don't know this person. And she called and said, do I have to go? And we were like, absolutely not. No, it's totally fine. But there's usually too, in this type of model, there's some connection usually because most of our patients come from word of mouth. There's so much word of mouth. So, we have not had that problem yet, but we're very much like, guys, don't do anything that you're not 100% comfortable with. And it's just a different level too, I think, of these are people seeking out cash-based aesthetic treatments, and we have to fill out all their information. We know where everyone is at all times, in terms of address. And it's just a kind of a different, I think, level of clientele, if you will.
Absolutely. And so that's amazing. I think that the model, while it's not traditional, I think that it's obviously doing really well. You said you have 130 or 230 injectors employed?
Yeah, 230. It changes we do a training every month and add new folks. So I hope I'm not like totally butchering that number. It could be like 228, but it's between 220 and 230. I can't remember the exact number.
Wow. That is amazing. The growth in 4 years in 32 states. That's really, really incredible. How is injecting, running a business, still living your life? How do you manage to tackle the most important things?
Whew. Well, I have a child next to me currently who barfed this morning, so didn't get to go to school. So thankfully, I have help, and we've got a great team. But it's a lot, and people talk about balance and work-life balance, and I don't think that exists. Shonda Rhimes actually gave a great graduation or matriculation speech. I think it was like a couple years ago, and she said, listen, when I'm killing it in my professional life, my family is suffering. When I'm killing it with my family, my work is somehow suffering. And it just is what it is. I prioritize my family as much as I can and when I need to, but they also, it's mommy works. And if you're going to stay home from school today, you got to be right next to me while I'm in these meetings. And travel can be a lot. It's a lot. And I never want to sugarcoat it and make people feel like, oh, she has it all together and it's easy, because it's really not. It's very difficult, but it's worth it, and it can be so fun and so rewarding, but it's difficult.
That's amazing. I think that the fact that you didn't sugarcoat it and you said, balance is not a thing, because it totally isn't. What do you say to those people that are interested in pursuing aesthetics?
I think that aesthetics can seem very glamorous and very like everybody's just hand over fist rolling in cash and, oh my gosh, I've got to do this because it seems very fun and glamorous, right? Mm-hmm. But the reality is that to be a good injector and to be in this field, it is more difficult than I think we let on, because I do think we want to give that impression to our patients that it's light and it's fun and it's aesthetics and it's pretty, but it's difficult, and business owners that I know, I think this is a huge part of the beauty of working for the Skin Clique, just like shamelessly plugging, because I have several very close friends and mentors that own their own practices. And we all, kind of lament about, gosh, just how difficult it is. I mean, it can really be all consuming. So I do love that we can give women, people, I say women, because right now it's all women. We don't have any men that work for us, which is, we would love some men. So if you're a dude and you want to get into this, hit us up. We're equal opportunity employees. It's just mostly women. But I love that we can give people the opportunity to get into this field, have some flexibility. You don't have to own your own practice, but at the same time, you're not a slave to, an 8 to 6 practice where they're telling you, oh, by the way, we now see patients after hours. Oh, by the way, we now see patients on Saturday. Oh, by the way, you didn't hit your numbers, or you got to see this X amount of people, or, how much revenue are you bringing in? I mean, we don't put that pressure on our injectors, and just so thankful that we can give people that opportunity, because it can be that way. Yes, owning your own business is all consuming and very difficult, but you don't have to do that to get into aesthetics.
Great points and great advice. So I do want to transition a little bit and discuss your Dabble Co podcast. Kind of the reason that you brought it about, kind of give everyone just a little snippet of the podcast and, where they can find you.
Yeah. So I started an Instagram page about 5 years ago, and God, I mean, it was so much work. I can't believe how much work I used to put into it. But I really just liked the idea of having kind of a general place for women to go get accurate medical information. And so I would collaborate with other APPs or physicians and post anything that had to do with anything women's health. So I might talk about thyroid or heart health or aesthetics, anything. And after about a year, somebody said to me, okay, you like to talk, you should start a podcast. And so I did, and it went really well. And it's called the Dabble Co podcast. I'm taking a break right now because I think I'm going to do actually what you're doing. I think it's a better way to do it. I'd like to record in batches and then put out seasons. It got to be really stressful to find a guest every week and find a time to record. And sitting down and carving out that time. But I think I'm going to do seasons coming up, but I just have medical providers on, right? Like I have physicians, pharmacists, nurses, PT, OT, anybody who's really a true medical provider talking about kind of debunking misinformation, but also giving a space to have conversations about, are these supplements, should we be taking them? Are they real? What about collagen? Things like that can quickly get debunked, but also we'd really like to have a space to talk about it. So you can find the podcast on Apple and Spotify, I think Amazon as well. It's the Dabble Co podcast. And then I'm on Instagram as Claire O'Brien NP.
Do you get some backlash with your transparency? There's so many different opinions about everything. So do you, in a sense, get some haters?
Yeah, it's interesting. I, for the most part, have really positive feedback because I think people do realize that there needs to be a space for talking about something as potentially misinformation, but also, is it harmful? Do people like it? Where does this fall into our health? And I typically hear positive feedback, but, every now and then there's definitely going to be, some pushback, but I think the biggest pushback I've gotten was when I did a series on abortion, which is obviously just a very difficult topic, but it was one of my favorite things I've ever done. I did 4 episodes and I had an abortion care physician and then I had a pastor, which that was the most backlash I've ever gotten. But I also knew that was going to happen. And, I felt it very necessary. And I, at the end, kind of gave my opinion, which I said, my opinion is also not clear. I don't even know what the right answer, and people really appreciated that. So yeah, I just try to be neutral, but helpful and also giving people the right information. I feel like is kind of where I try to land.
So I have listened to your podcast. I haven't listened to that series, so I do want to go back and listen to that. But I think that you're having really important conversations and I really appreciate you putting yourself out there. Abortion is a tough topic, and I think there are a lot of opinions and a lot of things. So I really appreciate you tackling that from a healthcare perspective. But I do actually want to talk a little bit. So your husband is a physician, and he's been a few episodes, and I've listened to a few of those and like listening to the both of you. How did you guys meet? And then how is that dynamic with both of you in healthcare?
It's really funny. So people love to listen to us banter, apparently. So I had to do some more episodes with him. But we met. I was a nurse, and he was a brand new, just out of residency physician, and we met out, randomly at a bar or something. But then we both were working at the VA hospital in Charleston, which is a fairly small hospital, but it's connected to the big teaching hospital. And I don't know if any of you. Probably your listeners are predominantly medical, but if you've ever worked in a VA hospital, most of the people that are there working there are significantly older. And so we're the 2 youngest people in the hospital. And we just became really good friends and then, dated and got married. But the dynamic, it's fun. I mean, we definitely, he also has his MBA. He is really now in kind of the business side of medicine. And so he, I would say, has been invaluable, in helping grow Skin Clique as well, because there are things that, Sarah and I never learned. You don't learn business in medical school or nursing school or NP school or anything like that. You learn nothing, about money, profit, revenue, COGS and EBITDA. And there's a bajillion different, all these acronyms. It's throw out an acronym and I'm like, we don't know what that means, but whatever. So, but it is fun, it's really most of the people in my family are medical. My father's a physician, my brother's a physician, my father-in-law was a physician. But then my brother is a businessman. And so it's been a really interesting kind of sweet, thing for me to grow into as an adult, where we can have all these really interesting conversations about medicine and business and the business of medicine. And it's fun. We definitely argue. I mean, he's really freaking smart. And so, I'm never going to win most arguments about anything. medical, but I do with aesthetics and women's health. He almost failed his OB rotation. So I'll be like, you are not allowed to talk about this.
That's so funny. For the business and your husband having his MBA, did you go back and do any continued education for business to learn, or was it kind of a learn as you go?
No, girl, it is learn as you go. I mean, I don't know if I would want to do that right now. Like yes, it's very learn as you go. I have not done any more. I mean, there's certain like podcasts and things that we'll listen to. And I know Sarah did the Stanford series to kind of, learn more about business. But it's a lot of book reading and podcast listening and that kind of thing.
Gotcha. It sounds like your whole family is medical. Any pressure to get into medicine? And would you do it all over again?
I would. Yeah, for sure. I would do it again. I've loved this career. I cried every day when I knew I was leaving my surgical oncology job because I loved it so much. I knew that this transition was the right thing to do, but I loved it. And I think that's part of where my brother and I, decided to get into medicine because we saw my dad love it, and yeah, I would totally do it again. It's been a great career for me.
Would you, if you went back today, would you pursue a different degree though?
I don't think so. I did adult nurse practitioner instead of family. And I'm still really happy with that decision because I knew that I really wasn't going to do pediatrics. And yeah, so I'm glad I did that. I mean, I think if you could have just all the hindsight in the world, if there was some kind of combined MBA and P program that I could have done, 15 years ago, then I, knowing I was going to own a huge multi-state business 20 years later, then maybe, but I've loved all my decisions. I don't know if that's too rose-colored glasses, but it's true.
No, I love that you're honest. What's actually funny is I'm the same way. So I'm currently in a DNP program, which is like a primary gero program, just because peds is also not my jam. Like my sister's a NICU nurse. I have really great friends that are peds nurses, but it's not for me.
Mm-hmm, mm-hmm. Yeah, I just knew.
Well, that's amazing. Is there any other advice that you would love to give to the aspiring injector or the new injector that's really kind of under 3 years? Any like last minute pearls that you'd love to leave?
Oh gosh, Injector Tawny posted something the other day that I thought was just so great. And it was just about how don't compare yourself to the Insta famous injector, right? Like these are people who are aspirational, but it's not the norm, right? And like so incredible what so many of them are able to do. But I think it can make people have this complex of I'm not good enough and I don't belong here. And that's just not right. You do belong here and you don't have to be a jet setting, business owner. You can be an injector and be just as happy and have a great time in aesthetics. And I loved that. So I think there's this kind of growing feeling of a lot of people that they don't belong in aesthetics because, their feed doesn't look that way or they don't dress that way or whatever the, insecurity is. And yeah, so just, encouraging you that people also want to see normal people that look like them and that talk like them and act like them. And that's a big part of the connection in aesthetics is connecting with your patients and just knowing that they want to see you and they love you for who you are too.
Absolutely. I think that it is hard. I know exactly the post that you're referring to that Tawny had posted, and I agreed. I loved it. I think that it is really hard looking at all of the bigger names. And I think that, comparison is the thief of joy 100%. And not comparing yourself to one type of injector. I think I love the fact that more injectors are now speaking out and are being more active about like, hey, like I don't dressed in full designer and I'm not jet setting everywhere. And, but I still am running a successful practice and I love my patients and I have good outcomes. So I think that that's really, really important.
Yeah. Yeah. And the conferences, I mean, my gosh, like I was talking to a friend the other day and was like, it's like you need a stylist to go to a conference and the conference on itself is $5,000. And it's just, it's gotten kind of out of hand, and just remembering that you don't have to do that to be a good injector. You don't.
How are you going about finding continued education?
So, we do a lot of our own education, and so we'll partner with different companies that we use and different brands, and we do a lot of their education, which is great, but you need non-industry sponsored education, right? So we really seek out people that we feel like we align with their aesthetic, and we will do things that way. I found, a couple of conferences that I really think are just more down to earth that I want to, that I attend. There's a conference here in Nashville next week called Scale that I think is just a phenomenal conference. It's like $800 and like 5 days full of just all the education you could ever want. I subscribe to, a couple of journals and newsletters. I watch, the video series that they put out and just things like that, just kind of trying to keep it a variation of where you're getting your education, I think is helpful, because you really will hear, it's like whoever's educating you you're going to hear like, this is the best way, or this is the only way. And so I think if you don't kind of round out your education, you can get stuck in thinking you need to use one product and use it a certain way. So just trying to keep it variable.
The amount of variation in aesthetic education and technique, it's very overwhelming for newer people, because one person will say, absolutely don't do this. And one person says, always do this and never inject this way, or bend your needle, or use this cannula, or never put this product there. Oh, yeah. So I think that it can definitely be overwhelming.
Yeah, for sure.
Well, thank you again, Claire, for coming on the podcast. Tell everyone again just where they can find you.
Yeah, thank you so much for having me. So I'm Claire O'Brien, NP on Instagram, and it's O'Brien with a Y. My company is called the Skin Clique, like CLIQUE. And we're all, the Skin Clique on all platforms, TikTok, Instagram, Facebook, wherever you are, we are as well. And would love to connect with you there.
All right, beauties, go and check out the Dabble Co podcast. The podcast Instagram is at aesthetic.chatwithkiki. My Instagram is at aestheticnurse.kiki. Podcast season is almost over, but again, thank you so much, Claire. Excited for the last 2 episodes to launch. All right, beauties, bye.